Now, the next skill that we're going to learn, you're not going to be able to practice at home, most of you, because this is transferring a patient out of bed and into a wheelchair. Most of you guys don't have wheelchairs at home to be able to practice with. And I'm going to show you a couple of things on the wheelchair to help you understand how wheelchairs work and how to engage the brakes and all of that. So I'm going to be moving the camera here in just a minute over to where the wheelchair is, so you can kind of see how this all goes together and how a wheelchair works. Now, at home, you can practice this by just using a chair to practice the transfer technique that I'm going to show you. So if you just put a chair by the side of the bed at a slight angle, we're going to talk about that, and then help the patient stand using a belt. For the test, you'll use the gait belt, and then pivot them around so that they're not taking steps, and then sit them down in the chair. It will help you kind of learn the steps to take for transferring out of bed and into a wheelchair, even if you don't have the wheelchair itself to learn how to use the brakes and things like that. So before I show you about the wheelchair, I'm going to bring up this particular page. Okay, so in your skills book, those of you who have the spiral book, go to page 49. So turn to page 49 of your book. And if you look here, this tells you all about the wheelchair and all about safety with the wheelchair. And we do use wheelchairs quite a bit in healthcare. So you need to learn the safety aspects of it. And probably the most important part of a wheelchair is the brakes. Now, I'm going to show you how to engage brakes in just a minute. But the brakes are usually located right here, right in front of the big wheels. There will be a lever right there that you will either push or pull the lever. Different wheelchairs are set up differently, but you'll either push or pull the lever, and that will engage the brake. There's a little metal bar here that actually bites into the wheel to stop it from rolling. But there's two times that the brakes really need to be applied. When you're taking somebody out of or putting somebody into the wheelchair, the brakes have to be locked. Have to. Because otherwise, as you move the patient, the wheelchair is going to move too. So the wheelchair has to be stationary and locked for you to put a person into a wheelchair or take them out. But it also needs to be locked when you walk away from the wheelchair. So if you have a wheelchair that has a patient in it, and you are leaving that patient in the wheelchair in a hallway, at an activity, wherever, you need to lock that wheelchair before you walk away. And that's because floors are rarely level. So if you have a patient in a wheelchair and it's not locked and the floor is not level, that wheelchair is going to roll because the floor is not level. And as that wheelchair rolls, because there's weight in it, it's going to gain momentum. So by the time that wheelchair hits something to stop it, and that something is probably another patient or a wall or a doorway, then it's going to be moving at a faster clip, and that means the patient is more likely to get injured. So brakes must be engaged when you walk away from a wheelchair. A question I get asked a lot, isn't that a restraint? If you put a patient in a wheelchair and you lock the wheels, isn't that a restraint? And the answer is no, it is not a restraint. If the patient can self-propel, if they can move that wheelchair by wheeling it with their own arms or by padding along with their feet, then they can unlock the wheelchair and go anywhere they want to. A locked wheelchair is not a restraint. Patients can unlock it. We didn't remove the locking mechanism to prevent them from unlocking. We just locked it for safety. Now, if the patient cannot self-propel, if they cannot unlock it, it definitely needs to be locked then, because the patient would not, if the patient can't self-propel, then they have no way of self-stopping. So if that wheelchair starts to roll, that patient can't do anything about it. Now, can you imagine how terrifying that would be? To be sitting in a wheelchair, not be able to do anything, having the wheelchair roll and you can't stop it, and you see this wall getting closer and closer and closer, and you're picking up speed toward that wall faster and faster and faster. Can you imagine the terror the patient would feel being helpless to stop the collision that's about to happen? So we need to understand that wheelchairs must be locked when you put a patient into or take a patient out of, and anytime you walk away from an occupied wheelchair. In reality, even if it's not occupied, the wheels should be locked because an empty wheelchair will still roll into somebody. So you can read the rest of this, guys, and I'm going to be talking about each one of these as we go. But that is the biggest safety concern about a wheelchair. So I'm going to turn you around here. All right, so this is a wheelchair. Wheelchairs are generally kept in the folded position, and that's so that they're smaller for storage. They fit in small spaces. To open a wheelchair up, if you're going to use it, if we want to open the wheelchair up, we're going to lift the handles up to get the big wheels off the floor. I'm going to put it at a slight angle so you can see. I'm going to lift these handles up to get the big wheels off the floor, and then I'm going to open the handles up as far as I can. Now, this should open the wheelchair. If it doesn't, you can press down on the bars. There's bars along the edge here to open the wheelchair up the rest of the way. Every wheelchair works just a little bit differently. Some are really easy to open. Some require a little bit more force and some downward pressure. If you're going to press on those bars, don't put your fingers down like this, because there's a gap right here. Can you see my fingers kind of disappear here? Right, there's a gap right here. If I've got my fingers in that gap when I push down on these bars, then the sides of the wheelchairs can actually pinch my fingers. So you want to press down with a flat hand, not with your fingers pointing downward. Now, to close a wheelchair up for storage, you're going to lift up on the center of the seat, and the two halves will go back together. So it's actually pretty easy. No buttons, no levers, nothing like that. It's just a simple mechanical open or lift up on the center to close. Now, on the side of the wheelchair, I'm going to turn it to the side so you can see, and I'm going to zoom in here. If you pull that lever back on this wheelchair, this bar bites into the wheel and it keeps it from moving. To unlock, you would go forward, and now the wheelchair can move again. So this wheelchair, the lock is, there we go. It's a little bit clearer. And on this wheelchair, the lock is engaged with this particular lever. You would pull back to engage the lock, push forward to disengage. Good? Okay, so now I'm going to move it back a little bit so you can see the foot pedals. Now these foot pedals, right down here, these foot pedals are designed to support the foot when the patient is in the wheelchair. Let me go ahead and look those. So when a patient's in a wheelchair, wheelchairs are taller than normal chairs, and I'm going to show you that in a minute. So when a patient is in a wheelchair, the whole purpose is so that they're mobile. We can push them places. So we don't want their feet flat on the floor, because then we couldn't push it. Their feet would be in the way. So wheelchairs are higher than normal chairs. But if you have a patient in a higher wheelchair, their legs are dangling. And dangling legs can lead to things like swelling, nerve damage, the potential for blood clots. So lots of pretty bad things. So you don't want legs to just simply dangle. So anytime you have a patient in a wheelchair, you're going to put these foot pedals down, and that's going to support their feet. But if you've got these foot pedals down, oops, let me go back here a little bit. If you've got these foot pedals down, it's really, really hard to get a patient into a chair like this because the foot pedals are simply in the way. So before we put a patient into the wheelchair, we're going to fold up these foot pedals, and then we need to get these leg rests, these two leg rests out of the way, because this is a very small area to get a patient's legs into. So to get these leg rests out of the way, there's a little catch back here on the back of the leg rest. If you pull the little catch forward, they simply swing out to the side. Same thing here. This is the catch right here. If you pull this, it swings out to the side. But once you get the patient into the wheelchair, then you're going to swing those leg rests forward, put the foot pedals down, and support the feet on the foot pedals. So let me show you what I mean when I say that wheelchairs are taller than regular chairs. I like to show this comparison. So can you see how much shorter this chair is from the seat of the wheelchair? I don't know if the perspective is coming through.
Yes,
but this
it
is probably about 3 inches shorter than a wheelchair. So wheelchairs are taller. The seat itself is taller than regular chairs. So you really have to address the feet. You've got to, you have to make sure that you get those feet on the foot pedals when a patient is sitting in a wheelchair. Otherwise, those legs are going to dangle, and that's no good for the patient. Okay?
Yes.
Any questions on that so far?
Oh, God. No.
Okay, so there's one more thing I have to tell you before I show you this video. And this is the challenging part of putting a patient into a wheelchair. And a lot of people watch me do this and they go, oh my gosh, there's no way I can do that. So what I'm about to show you, pivoting a patient onto the side of the bed, you need to practice this. And yes, you can do it. This does not require the upper body strength you think it does. What it requires is the proper setup. Okay, so when you've got a patient laying in bed, and you're going to see me do this on the video in a few minutes, the patient is laying on their back in the middle of the bed. You're going to ask the patient to scoot towards you so they're closer to the edge of the bed, and then you are going to pivot that patient around so they're sitting up on the side of the bed so we can put their shoes on, put the gait belt on, and then transfer them into the wheelchair. Now that pivot takes a little practice. And most people set it up wrong. When you're going to pivot a patient onto the side of the bed and they're laying in the bed, so I'm going to turn this around so you can see. If they're laying in this bed, my hand is going to go under their shoulders all the way to the furthest shoulder. My arm needs to be under their entire back. Now, this arm is not going to go under the knees, and that's what everybody tries to do. That's the biggest mistake. Don't put this arm under the knees. This arm goes over the knees. And if you set it up like this arm under the shoulders, this one over the knees, it's just a simple pivot, and then they're sitting on the side of the bed. If you have your arm under the shoulders and under the knees, now you're having to try to pull as you push, and that torques your back, and that's where you get back injuries. So it's under the shoulders and over the knees for that smooth pivot. Once you get the patient sitting on the side of the bed, we're going to put that gait belt around. How many fingers do we have to use to check it?
4.
4 fingers, that is right. So you'll put the gait belt around so that it's snug, and remember it goes at the waist. So put the gait belt around so it's snug, check it, 4 fingers, make sure the patient has shoes on. And for the test, you physically have to put shoes on them. You're going to have to put shoes on somebody and tie them if they have ties. And then you're going to get the wheelchair close to the bed. And when you're positioning a wheelchair for transferring a patient out of bed and into the wheelchair, you're going to fold those foot pedals up. Remember, get the leg rests out of the way. And when you get the wheelchair, when you're ready for the transfer and you're moving the wheelchair into place, bring it over so you can see. Okay. You're going to put the wheelchair close to the bed. And when I say close, I mean almost touching the bed. So we're going to get the wheelchair close to the bed, and we're going to have it at a slight angle. And it should only be about this far from the patient's knee. And I'm going to show you why in just a minute, but this is super, super important. So let me bring this around a little bit more so you can see. If you do not get the wheelchair close enough, you will not be able to complete this skill properly. Let me see here. I think I'm in the way. Okay. So you see how close that wheelchair is?
Yes.
Okay. It is almost touching the bed. It is about this far from where the patient would be. So that is probably the most important part of positioning to get this right. If you don't get the wheelchair close enough, it's actually going to affect your score. So let me bring up that page so you can see what I mean. This is page 50 in your skills book. And if we read the care plan, because we always know that that's where we start, is at the care plan. Care plan says transfer the resident from bed into the wheelchair. Well, we know that part. The resident is unable to walk or take steps. So that is the most important part of this care plan. If you don't get the wheelchair close enough to the patient, and the patient, as you're transferring them, unconsciously takes a step, you will fail the skill, because the care plan clearly tells us the resident cannot take steps. It says that the patient can stand with support, so you are not supporting this patient's full weight. This patient should not be dead weight on the test. A lot of questions I get are, well, what happens if the patient is bigger than I can safely handle? What happens if I'm supposed to transfer somebody that's too big for me? In a clinical setting, if you are afraid that you are assigned to move a patient that's much bigger than you are, that you don't feel safe, let the nurse know. But believe it or not, you can handle a whole lot more than you think you can with the right tools. If you've got a gait belt and you're using proper body mechanics and the wheelchair is close enough, you can actually move somebody with very little stress on you or them. You just have to make sure you're doing it properly. But if you don't feel safe, you have to let the nurse know. Now, if you remember, I'm going to stop this real quick so I can talk to you guys. If you remember, on the first day, I told you that the evaluators are going to check you in, and then they're going to go away for like 20 or 30 minutes. You're going to be wondering, what in the world are they doing? And I told you they're going to be pairing you up with somebody else for the test, that somebody else is going to be your patient. You'll be their patient. Well, this is one of the things that they're looking at. If I've got somebody who weighs 100 pounds soaking wet and is this tall, and they have this skill, transfer a patient out of bed into a wheelchair, I am not going to put them with the 400-pound, 6'6" individual that I have that's also testing. That is not a good matchup. So for the test, they're going to try to find somebody as close to your body size or smaller as possible. So, but they're also looking at some other things when you get checked in. They're looking at your teeth. If you have a lot of missing teeth, if you seem to be talking funny because you've got an abscess, they're not going to use you for mouth care or denture care. If you come in with a cast on your foot, they're certainly not going to use you for foot care. If you have a swollen ankle, they're not going to use you for ambulate with a gait belt or transfer out of bed and into a wheelchair. They look at you, and they look at the skills other people have that are there to test, and they want to evaluate, are you a good fit for one of these people, for the skills that they have to do? And there's a lot of things that they take into account for that, but their whole goal is to not set you as a patient up for injury or you as the tester up for failure. They're very, very aware of that. So they're not, remember that this has to be minimal skills competency. You are not this is not an advanced test. You're not showing, hey, look at me, I'm a master of everything, I've got it down cold. That's not what this is. This is entry level testing. So you're not proving that you're a master at anything. You're just proving that you have the minimum amount of skills to be safe in a clinical environment. So they're going to try to find somebody that's a little bit smaller than you, if possible, or about your size, to be able to transfer into a wheelchair appropriately. So for this skill, you are not going to be bearing the full weight of anybody. It says they can stand with assist. So let me pull that back up real quick here. Let's go over a couple other things. It says a gait belt is required to transfer the resident, and the resident will stay in the room after the transfer. So if we go down here, you can see that this is going to be done on a live student, and the patient will be in bed at the beginning of the skill. But the whole skill is to take them out of bed and put them into a wheelchair. This is going to take somebody with your level of experience about 11 minutes. It's not a long skill. The longest part of this is getting the patient ready for the transfer. So the patient's laying in bed. You've got to get them sitting on the side of the bed, and then you've got to get shoes on them, because if they're in bed, they're clearly not wearing shoes. Nobody's wearing full shoes while they're laying in bed. So you've got to get them sitting on the side of the bed, and then you've got to get shoes on their feet, and then put a gait belt on them before you can ever transfer them. So the majority of this skill is not the transfer, it's the preparation for transfer. That's what's going to take the most amount of time. The transfer itself is actually very, very quick. Up, over, can you feel the chair? Sit. Then we remove the gait belt, get the leg rests pulled forward, the foot pedals down in the supported position, get the feet on the foot pedals, and then get them in position where they can reach a call light. So the end of the skill actually goes pretty quick. It's all the prep that you have to do beforehand that's going to take the most amount of time. So make sure that wheelchair is close. It should be right up against the bed, this far from the patient's knee, so that when you lift them up, you're just going to turn them and then set them down in the chair. No steps. If they take a step, the wheelchair was too far away and you will fail the skill. But do you remember ambulate with a gait belt? When we went to sit the patient back down, we had the patient back up to the chair and then let us know that they felt the chair against the back of their legs. Mm-hmm. So you're going to do this with wheelchair too, because if you try to sit somebody down and they're not 100% sure there's a chair there to catch them, they'll unconsciously stiff it up because they don't want to fall. So when you're doing this skill, and the video isn't going to show you this, and that's why I'm pointing this out, because this is something that they are requiring that's not in the video. So when you stand this patient up and you pivot them around, you need to make sure that they feel that wheelchair against the back of their legs. So the way that I do this is, before I stand the patient, I tell the patient, okay, I'm going to stand you up on the count of 3 and pivot you. When you feel that chair against the back of your knee, I want you to say sit, and then I'll sit you into the chair. So you want to give them that little bit of extra instruction before you stand them up, because when you're standing there and you're holding that gait belt and you're holding their body weight, you don't want to have to give them all of those instructions. So I tell them before I lift, I'm going to stand you up on the count of 3. We're going to pivot. When you feel that wheelchair, say sit, and then I'll help you sit. And you won't hear me say that on the video, but you have to say it. Okay, so that's one thing that I want to make sure that you understand. All right, so any questions on how the wheelchair works? Any questions on that? Everybody good? Okay, hypothetically, if you forget or get confused in the middle of the exam on how the equipment works, like the wheelchair or the bed, can we ask for help? Yes, absolutely you can. So they don't expect you to know how the wheelchair works in that facility. And if you remember on day 1, I told you that when you go into the testing center, it's you, another testing student, and 2 evaluators in Florida. And they have to show you around and how everything works. Well, if one of you has this skill transfer out of bed and into a wheelchair, they're also going to show you how the wheelchair works at the testing center. But even halfway through a skill, let's say you get, to the point you're getting ready to transfer the patient into the wheelchair, but you can't figure out how to lock it, you can ask the evaluators, how does this particular model lock? Perfectly okay. And it's a much better thing to do to ask and get clarification and make sure that it's locked, rather than trying to transfer a patient into an unlocked wheelchair, because it would be an automatic fail. Okay. If the wheelchair is not locked, when you lift that patient up, it's an automatic fail, because if you try to sit a patient down into an unlocked wheelchair, it will roll away, which means the person you're doing this skill on has the potential for injury. So make sure that you lock it. But you can ask if you don't know how. So I'm going to show you this video. It's going to walk you through exactly how to do this skill from beginning to end. It shows you the working on the wheelchair. And then when I'm done with this, I'll take questions. So